Ontario expects vaccine supplies will be more predictable and more plentiful starting next week.
This is exciting news.
It means starting tomorrow, those aged 55 and older can book a vaccine on the provincial online portal. On Monday, May 3rd, bookings are expected to open for those 50 plus. May 10th, 40 plus, May 17th, 30 plus, and by May 24, all Ontario adults should be able to book a COVID vaccine. More than 100 COVID hotspots will get half the vaccine supply over 2 weeks in May.
The belief is that by doing it for 2 weeks very aggressively, not taking any vaccines away from the existing other public health units, we can actually really beat down the positivity rates within those communities and ultimately help all of Ontario get back to normal.
Critics say vaccinations should be more targeted in fewer hotspots for longer.
It's very clear from the science table that they've recommended that 74 hotspot communities be targeted with those increased allocations of vaccines. With that recommendation, it would take approximately 25 days to vaccinate those communities.
The health minister says all public health measures will still be required until most of Ontario has had 2 doses of vaccine, currently spaced as far as 4 months apart. But increasing supplies mean people may get their second dose earlier. The Johnson & Johnson vaccine is the only single-dose vaccine approved in Canada, and it hasn't been distributed yet. Some people who have had the first dose of 2-dose vaccines are still ending up in hospital with COVID.
People do receive a high degree of coverage after the first vaccine, and that if they do need to be hospitalized, it is more likely that they will have only a much milder case.
Remember that when you get a vaccine, it does take you at least 2 to 3 weeks to build up any immunity. Do not make the mistake and think that once you have a vaccine, you can throw off all public health measures and precautions. That would be a grave mistake.
Ontario Science Table warns that the province could also see the introduction of variants that are resistant to some vaccines, like AstraZeneca. But that vaccine is still recommended if available.
The B117, which is the overwhelming dominant vaccine, if we can get that level of protection up in the population, that will really help bring down the pandemic and allow control of any variant coming in. I think, in some ways, our greatest concern is about variants coming in that we really don't know much about, which is why restricting entry into the province is really important. But, if you make this sort of a personal question, I'm on a wait list right now for an AstraZeneca vaccine.
There were 1,400 pharmacies in Ontario, like the Shoppers in Oakville. They got an allotment of AstraZeneca, but most of that is already in people's arms. And the province hopes that it gets more AstraZeneca in time to give people their second dose. But right now, there's no delivery schedule for AstraZeneca. There is a study underway to see if people can get a different kind of vaccine for their second dose. There's also a pilot project getting started in which pharmacies will see if they can administer the Pfizer vaccine. It's more complicated because it has to be kept extremely cold and extremely stable. Nicole?